Hi guys, welcome back. It's Kale. If you're new here, welcome. Thank you for joining my channel today. I only have one other YouTube video on my page right now, so I'm pretty new here as well. So thank you so much for everyone for tuning in. Today I'm going to be talking about something that is near and dear to my heart, literally. Oh, my dog is in the background of my video. Don't mind him. So I'm going to be talking about warfarin today. So we're going to go over how warfarin works, what the typical side effects are, what kind of monitoring things, and you know, everyone's favorite thing about warfarin is that it has a billion interactions with just about everything on the planet. So I'm going to go through some of that and just talk a little bit about how to live on warfarin, how I've lived on warfarin. I've been taking warfarin for a little over 3 months now. And so having my education based on learning all about warfarin and the pharmacokinetics and all that fun stuff, and now actually taking it has been pretty crazy to put 2 and 2 together. Haven't met any other pharmacists on warfarin, so if you are a pharmacist who takes warfarin, please let me know, because I think it's kind of cool. I don't know, maybe that's just me, but stick around. We're going to talk about all that with warfarin in just a minute. So essentially, warfarin is an anticoagulant. It is a blood thinner, you might have heard it called, but it is an anticoagulant. There are many different kinds of anticoagulants. Warfarin is kind of one in its own class. All the other anticoagulants kind of function a little bit differently, but in the end, they all have the same goal, which is to thin your blood. So before we talk about warfarin, or I guess the first thing that we're going to talk about is, what does warfarin do? The official category, pharmacologic category, if we're getting into it, is a vitamin K antagonist. So essentially, we all know vitamin K has something to do with warfarin, because all the foods that we eat, we have to be mindful of how much vitamin K is in it. The reason why is because warfarin is this vitamin K antagonist, which basically means it goes against the function of vitamin K. Antagonist just means something that goes against something else. So in the case of warfarin, vitamin K is being blocked, essentially. So the whole mechanism of warfarin is a little bit complicated. So basically, I'll just say warfarin blocks the synthesis or the production of vitamin K that is needed. I swear, my dog starts digging in the couch every time I start filming. He was sleeping for the past 6 hours. Now he's awake. So essentially, as I was saying, warfarin blocks the production of vitamin K, and it, in turn, because we have less vitamin K, there are clotting processes that need vitamin K to carry out their whole process. And because there's not enough vitamin K, these clotting processes don't do their whole function. So in a sense, these clotting processes are being blocked, and there's all these other proteins involved, but just for the sake of simplicity, it's a vitamin K antagonist, and it's a blood thinner, also known as an anticoagulant. So now that we know how warfarin works, let's talk about what warfarin is used for. There are several indications for warfarin, meaning there's several different reasons why a person would take warfarin. But one of the majority reasons that people take warfarin is to prevent a clot. I mean, that makes sense. It's an anticoagulant, it's thinning your blood, it's to prevent a clot from developing. There's so many reasons why a person might be more prone to developing clots, so I won't get into all those specific reasons. But if your body has some dysfunction, some missing piece that makes you more susceptible to developing clots, then you're probably on a blood thinner, possibly warfarin, that is preventing that clot from developing. Another reason that people take warfarin is for heart arrhythmias. So that just means when your heart is beating irregularly, and this heart arrhythmia, typically where you would need anticoagulation, is called atrial fibrillation. You may have heard of it called AFib, same thing. So this is a reason that people take anticoagulation, because when your heart is beating irregularly, it can cause the blood in your heart to pool and form a clot, And then when your heart starts beating normally again, it can shoot that clot straight up to your brain. and cause a stroke. And it sounds very scary, and it is very scary, and it's very serious. So if your doctor has diagnosed you with an atrial fibrillation and has recommended that you take anticoagulation, it's so extremely important to take it. It's extremely important to take it for all indications, but just re-emphasizing the importance of taking your medications. And then lastly, the other big reason that people take anticoagulants like warfarin is when they have a mechanical valve. So that would be kind of like my case. So the reason that I take warfarin is because I had an aortic dissection, and during my dissection, my aortic valve was damaged. And so that caused me to need a replacement aortic valve. And anytime you have a mechanical valve placed in your heart, you do need to be on anticoagulation. So there are prosthetic valves and there are mechanical valves. Typically, prosthetic valves do not require anticoagulation. My husband actually has a prosthetic valve. He was born with tetralogy of Fallot, which is a congenital heart defect. And so he has a prosthetic porcine valve and does not need to take anticoagulation whatsoever. But in my case, with the mechanical valve, I do. Some people have often asked, why take mechanical valve if you can have a prosthetic and not have to deal with warfarin and all this anticoagulation business? The reason is, you know, truthfully, when I was going into surgery, I had an emergency surgery, so I really didn't have time to discuss my options. But the only question I asked my surgeon was, can I have a prosthetic valve? Because being a pharmacist, I already knew mechanical valve meant anticoagulation for the rest of my life. I was a very active person, and so anticoagulation was something that was very scary to me. And my surgeon straight up said, no, we're gonna do a mechanical valve. And the reason for that being, mechanical valve lasts a lifetime. A prosthetic valve lasts usually 10 to 15 years, and then you have to continuously have it replaced. And while, you know, you don't have to have open heart surgery most of the time to have it replaced, they can do it through a catheter procedure. It is a risky procedure to constantly be going under for this procedure and constantly having to worry about it, and it's just safer a lot of times. It's preferred in younger patients to have a mechanical valve, just so that through the course of their lifetime you don't have to keep going through surgery. And yes, you have to take anticoagulation, but you know, is it the worst thing? I honestly don't think so. So with most medications, we just take them and we just have good faith that the medication is working at its therapeutic effect. It's working as best as it possibly can in our body. But you know, there are some medications out there that need levels to monitor how efficacious they are. Efficacious meaning how well they're working in our body. So warfarin, unfortunately, is one of those medications. So it does require blood levels fairly frequently when you first start taking it, and as you become more stable, you can get them less frequently. But the blood level that we measure is called the INR, the International Normalized Ratio. So this is a very long word. We'll just call it INR, which is what most people call it. But INR is essentially, a simple way to think about it is how thick is your blood or how thin is your blood. So if your INR is high, that means your blood is thinner. If your INR is low, that means your blood is thicker. So that's kind of just a simple explanation of INR. In most cases, your doctor will probably, your doctor or pharmacist, I should say, I need to advocate for my people, will tell you that your INR goal, where you want to be, is between 2 and 3. That is a very common goal for most people. Of course, there are always exceptions. In the case of mechanical valves, typically the goal is a little bit higher. So with mechanical valves, the goal is usually 2.5 to 3.5. In my case, I can tell you from my experience, I have the Onyx valve, which is a newer mechanical valve on the market, and it's actually the only valve that is approved for a lower INR goal. So my goal is a little bit less than the 2.5 to 3.5 range, but I still have a mechanical valve. So essentially just follow the goal that was given to you by your physician or your pharmacist. If you are not sure what your goal is, please reach out to your medical team and ask, because that is very important to be able to make sure that you are on the right level of medication for whatever your indication is. So most people who take warfarin, if you ask them how they like warfarin, they'll usually be like, kind of sucks. And you know, I'm not going to argue with that. Sometimes it does suck. There are a lot of interactions with warfarin. There's a lot of food interactions, there's drink out interactions, and there's even medication interactions. And there's not just a couple. There's pages long worth of interaction. So when it comes to interactions, even though there's a million billion interactions out there with warfarin, you do not need to avoid anything with warfarin. Nothing. The key is that you need to be consistent. Consistency is key. I shouldn't say that you don't have to avoid anything, because there are some things that you have to avoid. But when it comes to food and most medications, even drinks, it's not about avoiding it completely. Like if you are absolutely obsessed with grapefruit juice, even though grapefruit juice and warfarin have an interaction, you can drink it because we're monitoring your levels. But you should keep it consistent. So if you drink a glass of grapefruit juice every day, you better drink a glass of grapefruit juice every day for the whole time you're on warfarin, right? So don't be drinking a glass one day, 10 glasses the next, and then none. Okay? Keep it consistent. Consistency is key with warfarin. That is really all you need to know. It's not really all you need to know, but so let's start with food interactions. And just to mind you, I'm not going to go through every single interaction because we will be here for a lifetime. But I'll just talk about some of the big things. So with warfarin, the big thing when it comes to food interactions, that would be, drum roll, vitamin K containing foods. That was so unexpected, right? So when it comes to eating, we just have to be a little more vigilant about what we're eating, how much vitamin K is in it, and is it going to affect our warfarin. I've heard different things about how people deal with this. Some people are like, I'm gonna just eat whatever I want and I'll change my dose of warfarin every week when I check my new blood level. For me, I personally would like to just be on a stable dose of warfarin, not have to prick myself every week with a needle and check my blood, and just, you know, be smooth sailing. I don't need to eat everything in the world, so I'm okay with that. So you do you decide what method works for you, but you know, when it comes to warfarin, you have to be a little bit more vigilant about the food. So the biggest vitamin K containing foods, of course, are the green leafy vegetables. Coincidentally, that is the class of food that a lot of people already don't like. Me personally, I dig me some kale chips. You know, I like to sit around on a Sunday afternoon and have a bowl of kale chips, but unfortunately I can't partake in that anymore because I'm not going to eat a bowl of kale chips every day. No thank you. So I've just decided to completely cut kale out of my life. It's okay, I can live without it. It's okay. So if it's a green leafy vegetable, just look up the vitamin K, make sure. And if it is a green leafy vegetable that you love, like let's say you love eating a spinach salad 3 times a week, that's awesome. So you should eat your spinach salad 3 times a week. Just make sure, like I said, consistency is key. Eat your spinach salad 3 times a week. All right? It's a very good accountability partner, this warfarin. So other than food, there are a couple of other things that can affect INR. One being alcohol. That can actually increase your INR, making you more at risk for bleeding. So from a medical perspective, alcohol will always recommend for you to abstain from alcohol. But if you do choose to drink it, then just be wary of this, that it can and will increase INR, and so we don't want you to have any bleeding, whether that be internally or externally. You know, uncontrolled bleeding is never good. So just be aware of that. If you do drink alcohol, try to limit it and try to keep it consistent so that we can keep your INR within the normal range. Wow guys, I just talked at the camera for like 5 minutes and then realized that it was not recording. So, of course there's all of the medication interactions. There's so many that I'm not gonna go through the whole list, but just be aware that some medications increase INR, some medications decrease INR, and there's really no rhyme or reason, and it's kind of hard to give you like some pattern to look for. But basically all I can tell you is if you start a new medication, please keep your physician or pharmacist, whoever is keeping in touch with your warfarin and adjusting your dose, please let them know any new medications you start. And that applies to over-the-counter medications. So that applies to herbal supplements, vitamins, any type of over-the-counter medication. A lot of herbal supplements do interact with warfarin, and so that is something to be aware of, and it is something to keep in mind. So a couple that I can name right now is ginseng, St. John's wort, garlic, even ginger and turmeric. And I have had a lot of questions about, you know, can I have ginger in my food? Can I eat garlic in my food? Can I drink my turmeric latte? The answer is yes. In your diet, those foods are fine. The problem is when you take those foods, those herbs and supplements in such high quantities that it is going to affect the warfarin, it's going to affect your INR. Turmeric, for example, if you sprinkle some turmeric on your food, it's really completely different than taking a capsule that's jam-packed full of 1,000 milligrams of turmeric, right? So we just want to keep it at the minimum. Turmeric does increase your INR, it can increase your risk of bleeding. So just kind of some things to think about. You can eat it in your food as long as you're not dumping. I don't think anyone wants to eat a handful of turmeric. If you do, I'm sorry. But essentially, you just want to, again, consistency is key, and try to avoid taking high quantities of those supplements. And if you do, very important to let whoever is managing your warfarin know so that they can take that into account when they are adjusting your dose of warfarin. So the last thing we're going to talk about today is what to do when your INR is out of range. So of course there should be somebody, some provider, pharmacist or physician or nurse practitioner, or a nurse following your warfarin. So they should be giving you recommendations on your dosing, they should be following up your INR levels, and they should be helping you with that. That being said, if you happen to go get your INR tested and it's still 1.2 and your goal is 2.5 to 3.5, the important thing is to relax, know that it's okay. The goal is to just get you there as fast as possible to your therapeutic range, but it's not a magic medication. It's not going to happen overnight. When you make medication changes to warfarin, so let's say you were taking 3 milligrams a day and then your physician increased you to take 3 milligrams 5 times a day and 4 milligrams 2 times a day. So you had a dose increase. You're not gonna see, if you had your INR checked the next day, it's not gonna suddenly be higher. It takes 5, maybe even up to 7 days to see a change in your INR based on your dose. So it's not a fast acting medication. It's not, you know, if I don't have my therapeutic level right now, something bad is going to happen. So just relax, everything's going to be okay. It takes time. It took me at least a month to find a dose that I was somewhat stable at. So it's not something that's going to happen so quickly and overnight. The next thing to remember is to always monitor yourself for signs and symptoms of bleeding. So what does this mean? This means if you have a bowel movement and you look at your stools and there's blood in there, or your stools are very dark and tarry looking, then that means you could have internal bleeding. Or if you go to urinate and your urine is red, like bloody, then that is a sign of bleeding. So if you have symptoms like this, or even something a little bit more minor, like you had a cut on your arm, you cut yourself while you were cooking, and it's still bleeding 2 days later, then definitely let your provider know, because this could be a sign that your INR is too high or that you have some bleeding occurring in your body. It sounds scarier than it is, but if you do notice any of this, it's just important to get medical care as soon as possible to prevent anything further more serious from happening. The good news about warfarin is that it has an antidote. So like we said, warfarin is a vitamin K antagonist. So what do we think the antidote is? Vitamin K. That's right, vitamin K. So essentially, you know, if you are having a very high INR and you're bleeding, don't worry, because vitamin K can reverse the effects of warfarin. Not to say that that's going to solve all your problems, but it is a little bit peace of mind to know that. But essentially, if you notice any unusual changes in your body, you know, you're bruising, like having huge bruises on your body that are just unexplained for no reason, then definitely let your doctor know, because that is not a good sign when taking warfarin. So I hope you enjoyed this video. I hope it was helpful. Let me just say, I didn't say any of this to scare you. I just think there's a lot of realities to taking anticoagulation and warfarin. And honestly, if there's anything you take away from this video, it's just to be consistent, take your medications, be patient, and everything is going to be okay. Everything will come together, so don't worry. Thank you so much for tuning into this video. I would really appreciate if you like this video and subscribe to my channel to stay up to date with all my new content. My next video, I'm going to be talking about tips for recovering from open heart surgery. I had my open heart surgery 3 months ago, so I'm really excited to be able to share that with you and talk a little bit more about that. If you have any questions, please leave a comment down below. And as always, I hope you all have an amazing day. And yeah, so see you next time on the next video. Bye. Also, a fun fact about warfarin that I wanted to put in this video, but my camera is dying. Warfarin originated as a rat poison. So I thought that was kind of cool that it was a rat poison, and now it's used for such awesome purposes, and it keeps us alive, and I think that's really cool. So take your warfarin. Don't forget to take your warfarin tonight. Okay, bye guys.